Hello people, namaste. Welcome back to my channel. In this video, I will discuss about the another important question from the chapter of asphyxiants. In previous video, I discussed about the carbon monoxide and cyanide asphyxiants. Now I will discuss about the another important short answer called war gases. War gas. War gas. Okay. What is war gas? War gases. War gases are generally are gas are in the form of gaseous, liquid, or solid. Any form, gaseous form, liquid form, or solid form. Any form of them are present in war gases. So some of the war gases I will discuss. First one is vesicant. Vesicant are blistering gases. Blistering, R-A-N-G. Okay, blistering gases. Vesicants. Vesicant are blistering gases. Vesicant gas are blistering gases. Examples of vesicant gases. First one is vesicant gas. Vesicant gas example is mustard. Mustard gas. Example is mustard gas and levisite. In the vesicant gas, mustard gas is used. So in war gases, vesicant gases are used. Example is mustard gas. So in mustard gas, what is the property? Like irritation to eyes, nose, throat, and nausea, vomiting, abdominal pain, all blisters are formed. So it is called blistering gas. Mustard gas, because of mustard gas, irritant to eye, nose, throat, nausea, vomiting. And blisters will form, so it is called as blistering gas. Then how you treat? Because of the irritation to eye, nose, how you treat? First, move to fresh air. Move to fresh air. Wash with soap water. Then here bleaching powder is used to neutralize the mustard and levisite. Mustard, levisite, bleaching powder is used. Bleaching powder, you should remember bleaching powder to neutralize it. You neutralize it, bleaching powder is used. Next, povidone iodine ointment for blister control. Blisters are formed now. For blisters, what we used? Povidone iodine. Povidone iodine. Povidone iodine used for blister control. Again, for only levisite, can we use ball as an antidote? Ball. Okay. For irritation is also present. No irritation of eyes. All this. That irritation can be decreased by N-acetylcysteine. N-acetylcysteine. So first one is vesicant. Vesicant is also called blistering gas. This is one of the war gas. Okay, the examples are mustard and levisite. Okay, what is the properties of mustard gas? Mustard gas, because of mustard gas, irritation to the eye, nose, throat, nausea, vomiting, and blister formation. So how can we treat this condition? First, move to fresh air and so wash with soap water. First point. Next, use bleaching powder to neutralize the both mustard gas and levisite. To neutralize only levisite, we should use ball. Okay, for controlling of blisters, we can use powder and iodine solution. Controlling of irritation, we can use N-acetylcysteine. So this is the one of the war gas of war gas. It is a vesicant blistering gas. Next war gas is asphyxiant gases. Asphyxiant gases. What are the asphyxiant gases? Chlorine, phosphine, diphosphosine, all these are asphyxiant gases. Chlorine, phosgene, not phosphogene, phosgene, diphosgene. Okay, chlorine, phosgene, diphosgene. What are the gases comes under asphyxiants of war gases? Phosgene, diphosphogene, and chlorine. Okay, all these are come under the after because of the chlorine, phosphine, diphosphine clinical features. What will happen to them? We can get dyspnea, coughing, feeling of some tightness of chest, pulmonary edema. All this can occur. See, dyspnea, coughing, tightness of chest, and pulmonary edema. Sometimes death. So how can we treat this condition? We can use oxygen. First, because of dyspnea, coughing, we can use oxygen. Oxygen. After that, antibiotics also used. Adrenaline also used. This one only. Oxygen, antibiotic, adrenaline, symptomatic, and supportive therapy. Okay, this is the one of asphyxiant gases: chlorine, phosphosin, by diphosphosin. So what is the properties of this clinical features? It causes dyspnea, coughing, tightness of chest, and pulmonary edema, and death. So what the treatment is? First you give the oxygen, after that antibiotics or adrenaline, then only symptomatic and supportive therapy only. First, I discussed about the vesicant blistering gases, mustard gas, and leaves. I discussed about the asphyxiant gases, chlorine, phosphosin, and diphosphosin. Now another war gas I will discuss. That is called like lacrimatters. So lacrimatters is also called tear gas. Lacrimatis is also called tear gas. It is an eye irritant. Okay, lacrimatis is eye irritant. We can call as war gas eye irritant gas, like lacrimatis. Lacrimatis. So what are the gases comes under the lacrimatis? CAP, BBC, BB. What is the CAP, BBC, BB? CAP means chlor acetophenone. How can you chlor acetophenone? This is CAP. BBC means bromobenzyl cyanide. Bromobenzyl cyanide. Next, BB means benzyl bromide. Bromobenzyl. Here see bromobenzyl cyanide. Benzyl bromide. Cap means chloroacetate phenone. So three lacrimatters like tear gases, they are eye irritants. What are the three? Three you should minimum three remember. You should CAP, BBC, BB. CAP means chloroacetophenone, bromobenzyl cyanide, bromobenzyl bromide. All these three cap, BBC, BB comes under lacrimatters. Okay. What are the clinical features of BB, BBC, and SCAP? Which is eye irritant? You should write the irritation of eye with copious flow of tears, spasm of eyelids, temporary blindness, all eye. See, irritation of eye, copious flow of tears, spasm of eyelids, temporary blindness also. Spasm of eyelids and temporary blindness. So temporary blindness. All these are clinical features of the lacrimatters. You should remember lacrimatters. Lacrimatters are what is that? Tear gases. It's also called as tear gases. And it is eye irritant. What are the examples? What are the gases comes under lacrimatters? Lacrimatters are cap, BBC, BB. Cap means chloroacetate, acetophenone. Chloroacetophenone. And next, BBC and BB. BBC are what is a BBC? Bromobenzyl cyanide. BB means benzyl bromide. What are the clinical features comes under this? It causes eye irritants. No, so these are the irritation of the eye with copious amount of tear flow and spasm of eyelids and temporary blindness. All these are clinical features comes under this. Next other war gas is sternutators. What are sternutators? Sternutators are called nasal irritants. Before I discussed lacrimatters, they are eye irritants. They are sternutators are nasal irritants. Sternutators are the nasal irritants. Here, DA, DM, CD. DA means diphenyl chloramine. Chlorarsine. Diphenyl chlorarsine. A means arsine. Diphenyl chlorarsine. Okay. Here M means diphenyl amine chlorarsine. Okay, same. Diphenyl amine chlorarsine. CD means same. Diphenyl synarsine. Diphenyl Sine arsine. Diphenyl sine arsine. Diphenyl chlorarsine. Diphenyl chlorarsine. Diphenyl amine arsine. Here also same. Diphenyl sine arsine. Sine arsine. All these are comes under steroids. What are the clinical features of steroids? It is nose irritant. Irritant to nose, sneezing, headache, nausea, vomiting, salivation, all occurs. Irritant to nose, sneezing, headache, nausea, vomiting, salivation. Treatment are just wash with water. Next one is paralysants. Paralysants are carbon monoxide and HCN. Next other gas comes under paralysants. I discussed already carbon monoxide and HCN in previous videos. You can check that. After that, nerve gas. Last gas is nerve gas. Nerve gas is sarin, sabun. All these are comes under this. Sarin, tabun, soman. VX is one of the gas. What is action? Similar to the organophosphates only. Similar to organophosphates. So, if what organophosphates inhibit? Inhibit acetyl ACHC. See esterase. Esterase enzyme. Acetylcholine esterase. So, postmortem and treatment are similar to OP poisoning. Signs and symptoms are similar to OP poisoning only. So these are the gases comes under war gases. I discussed 6 war gases. First one is vesiculants. Vesiculants. First one is vesiculants is also called blistering agents. Vesicants. Sorry, vesicants. Vesicants. Okay, vesicants. Okay, vesicants. What are the vesicants comes under this? You should remember vesicants are, what are the vesicants? Mustard gas and the levisite. Okay. Next I discussed about the asphyxiants. Asphyxiant gas. Asphyxiant chlorine, phosphine and diphosphine. Next I discussed sternators. Sternators and sternators means nasal irritants. Sorry, eye is a nasal, but eye irritants are lacaromators. Lacaromators are eye irritants. Lacaromators eye irritants, nasal irritants. Sternators are nasal irritants. What are the comes under lacaromators are CAP, BBC, BB. But sternators are DM, DA, DC. Sorry, cyanide, CD. Diphenyl cyanamide, CD. Cyanamide. So these are sternators, lacaromators, eye irritant. Next, paralysants. Paralysants are carbon monoxide, HCN. Last one is nerve gas. Nerve gas are cyanide, sabun, sarin. All these are comes under same as organophosphates. So I will explain. See easily. War gas. First, war gas are gases, liquid gases, liquid and solids. So these are 6 gases are present. Vesicants is the form of blistering gas. Vesicants is the blistering gas. What is vesicants? Vesicants comes out of mustard and levisite. It is irritation to the where? Irritation to eyes, nose, throat, all irritation. Eyes, nose, throat and nausea, vomiting, and they have blister formation and abdominal pain. All these come because of this. Move to fresh air and soap water. Wash with soap water. Neutralized by these two by povidone iodine, and blister controlled by the bleaching powder, povidone iodine, and ball is a levisite and acetylcysteine for irritation. These are vesicant gas. Next, asphyxiant class are chlorine, phosphine, and diphosphine. Clinical feature dyspnea, coughing, feeling of tightness of chest, pulmonary edema. Treatment are O2 antibiotics, adrenaline supportive and symptomatic treatment. Next, lacaromators. Lacaromators are, what are the lacaromators? CAP, BBC, B. CAP means what? Chloracetine, acetophenone, and bromobenzyl cyanide and benzyl bromide. These are lacaromators. Lacaromators are eye irritants. So same, this irritation of eye, copious amount of flow, spasm of eyelids, temporary blindness, all will occur. Next, steroids. Steroids, what are nasal irritants? Nasal irritants are DM, DA and CD. Diphenylchloramine, diphenylamine chloracine, and diphenyl cyanide chloracine. Clinical features irritant to nose, sneezing, headache, nausea, vomiting, salivation. Treatment with wash the cloth. Paralysants gases, carbon monoxide and HCN. Nerve gases, sarin, sabun, tabun, VX. Treatment are similar to organophosphates which inhibit the acetyl esterase. Postmortem reaction and treatment are similar to organ poisoning. Signs and symptoms similar as organophosphorus poisonings. Thank you. Please subscribe my channel. Please support us. Thank you.